Hello everybody, my name is Cydnee Walker, and today my presentation is going to be about HIV and AIDS. So what's the purpose of this presentation? So the point I want to get across by talking about HIV and AIDS is I want to raise awareness about the recent treatment options for HIV and AIDS, and I also want to help people understand the importance of getting tested early. There's a lot of fear around this disease because it's incurable, which is very understandable, but luckily we live in a time now where it's actually possible to live a long life with HIV. So let's go to the next slide. All right, so before I get into the details, let's talk about what HIV and AIDS are. HIV is a virus that can be sexually transmitted. It's usually sexually transmitted, but it can also be transmitted through blood, in addition to semen and vaginal fluids. And what it does is it basically attacks the cells that are meant to fight off any infection or disease you have in your body. So it makes your body open to getting other diseases and viruses. If HIV turns into AIDS over time if you're not treated, and at the moment there is no cure for the disease. So the symptoms of HIV is fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. And basically you'll see this in the acute stage, and which is the first stage, and then you'll see it in the second stage as well. And if you prolong it and you don't get any treatment for your HIV, it can turn into AIDS. And as you can see, the symptoms for AIDS are a lot worse. You get rapid weight loss, reoccurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph gland in the armpits, groins, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, genitalia, pneumonia, red, brown, pink, purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. So, and obviously the reason why it gets worse like this is because your body is open to more diseases. And it doesn't have enough of those cells that are meant to fight off the virus, so it just progresses and gets worse. All right, so the backstory for HIV and AIDS. So it's believed that HIV and AIDS was discovered in the 1800s. The real assumption is that humans were possibly consuming primates back then. Because the selling of primates' flesh was a delicacy in the region, and they believed that the HIV and AIDS infection was in the primates, and it got passed on to humans due to humans eating primates. So the AIDS epidemic as a whole began in 1981. That was an era where it became very prevalent, and there wasn't enough information to cure the disease or even come up with a treatment plan. So a lot of people lost their lives to this disease back in the 80s. Thousands upon thousands lost their lives to this disease. One of the most famous people who contracted AIDS and died from it at the time was famous rock star Freddie Mercury. And eventually in 1987 was when they came up with not necessarily a cure, but a treatment plan that could possibly prolong your life and help you live with the virus. And that treatment was called AZT treatment. And basically what this did was I would call it the blueprint for our new treatment that we use today, which is ART. But basically what it did was it would attack it would attack the virus and keep it from attacking the cells. And this was great in the beginning, of course, like it helped, but eventually there were problems with this. There were reasons why this medicine didn't work. One of those reasons was, in order for it to be effective, it had to be combined with other treatments. So it wasn't something that could treat AIDS or HIV on its own. It had to be used with other things. The other problem with this was it would cause problems with the liver, and it would also cause problems with blood count. It would bring your blood count down. And I'd say one of the worst parts about this treatment was that it was very expensive. Not everybody had access to this treatment at all. It was usually people who were more wealthy. And finally, the medication, it could not combat the different mutations of HIV and AIDS. So over time, when people would be using this treatment, the virus would start mutating and basically combating the medication, and this medication couldn't account for that. So in the end, it wasn't an effective drug for this virus. Fun fact about this, actually, it was originally intended to treat cancer. But when doctors started using it on HIV patients and AIDS patients, they realized it was actually more effective to treat this disease than cancer. All right, so next slide, antiretroviral treatment, or ART therapy, basically. And what it does is it's similar to AZT, where it combats the virus, but what it does is it can weaken the symptoms to the point where the virus becomes undetectable. So if you're in like the third stage of HIV or you have AIDS, it can possibly weaken the virus to the point where it's in its acute phase, where it's undetectable, and because of this, it prevents you from spreading. It prevents an HIV patient or an AIDS patient from spreading the disease to another person. At the moment, it's still not considered a cure, just because it still can't completely wipe out the virus. And in the beginning stages of HIV, the virus is undetectable. So even though you can't spread it to someone during that period of time, it's still there. So and there's just no way to completely wipe it out from a person's body. So unfortunately, it's not a cure, but it's very close to a cure. With this treatment, you can still live a long, healthy life. You'll still have HIV, but the symptoms will be so weak that it'll just be impossible not impossible, but just very less likely to pass it on to someone else. And it's more effective if you start treatment early, in the earlier stages. It's harder and it takes way longer to treat someone's AIDS or like higher stages of HIV versus, starting when you're already in the acute stage or the second stage. All right, so next slide. These ART treatments come in 6 different forms of medication. Usually only 3 of these are used in the beginning stages, because what it does is it blocks the virus from invading the cells. But if it's already invaded the cell, or if it's possible that one of the cells could have been invaded, you'll start treatment with the last 3. So the first 3 is fusion inhibitor, CCR5 antagonist, nucleosides reverse transcriptase inhibitors, or NRTI. So what those do is it focuses on the proteins of the cells. It blocks any entryway for the virus to enter the cell. And like I said, this is usually used in like the acute phase and the second phase. So NNRTIs, what they do is they cling on to integrates DNA and basically prevent the disease from entering the nucleus of the cell. This is very important because, if it gets control of the nucleus, then, the whole cell is going to be infected. So what it does, it prevents that from happening. The fifth type is integrase inhibitors, and what these do is they prevent our cells from self-destructing. So it basically prevents the cell from being destroyed if it does get infected with the virus. So the sixth type is called protease inhibitor, and what it does is it prevents the infectious particle from being produced. So it keeps the cell from becoming a viral particle. Usually higher quantities of this medication are used on patients just to make sure they wipe out most of the virus. It's just an extra precaution to make sure, because like I said, the virus parts of the virus could be undetectable in the person's body. So this, in this case, this makes sure that you have a higher chance of destroying those viral particles. All right, I'm going to conclude this with this last question. Why is early testing so important? So with early testing, you can not only increase your chances of living a longer life with the disease, but you can also prevent the spread of HIV and prevent yourself from developing AIDS from your HIV. So the main point of this video is to get tested. If you feel like you are showing any symptoms of this disease, of course use protection, but if you're having unprotected sex and you start having these symptoms, get tested immediately. You can increase your chances of living a longer life, and again, weaken your symptoms and prevent yourself from giving this to other people. All right, and these are my sources. And thank you for watching my video.